Hi, my name is Lukolic and I'm a physician here at Nanticoke Physicians Network. I'm a gastroenterologist and I'd like to share with you a few thoughts on gastroesophageal reflux disease. Often I get asked, what is GERD, as commonly called? GERD is a chronic digestive disease. It occurs in the stomach when acid or occasionally stomach content flows back into your food pipe, known as your esophagus. Some of the signs and symptoms you should be aware about is that you have acid reflux, you have burning, you also feel like you have a acidic taste in your mouth when you swallow. GERD occurs when you swallow and the lower esophageal sphincter, a circular band of muscle around the bottom part of your esophagus, relaxes to allow food and liquid to flow down into your stomach. Then it closes again. However, in GERD, if this valve relaxes abnormally or weakens, stomach acid can flow back up into your esophagus, causing frequent heartburn, irritation, and this is very disruptive to people's daily lives. Often I get asked, what's the prevalence in the United States? 60% of the adult population will experience some type of gastroesophageal reflux within a 12-month period, and about 20 to 30% will have weekly symptoms. Approximately 7 million people in the United States have some symptoms of GERD. Some conditions have been well described in the literature to increase your risk of GERD. Most notably, obesity, bulging at the top of your stomach into the diaphragm, which we know or call as hiatal hernia, pregnancy, smoking, asthma, diabetes, and delayed stomach emptying. Certain autoimmune conditions such as connective tissue disorders, namely scleroderma, could also cause that. Some of the consequences of GERD: this constant backwash of acid can irritate the lining of your esophagus, causing it to become inflamed, which is known as esophagitis. Over time, the inflammation can wear away the esophageal lining, causing complications such as bleeding, esophageal narrowing, or a precancerous condition called Barrett's esophagus. The way we diagnose this, aside from behavior and lifestyle modifications, sometimes doctors must pursue further testing, namely a Bravo system where the doctor measures the pH to determine if you have acid reflux and the severity of it. And it usually takes about 24 to 48 hours to complete, and measures acidity in two ways: how often the stomach acid flows into the lower esophagus and the degree of acidity during the test period. Or we can do endoscopy. A gastroenterologist will determine which is the right test for you depending on your risk factors after completing a thorough medical history and completing a physical examination. Nanticoke Physician Network can offer a wide array of diagnosis modalities, treatment, and comprehensive follow-up of these conditions by a team of highly skilled physicians, nurse practitioners, and surgeons experienced to manage this condition and its complications and associated conditions such as hiatal hernia repair and gastric bypass. Please feel free to give us a call at 302-990-3300 or visit our website at nanticoke.org.